everyone, I'm Dr. Gabi and this is Inner Vet, where we talk everything about pets. And today we're going to talk about a very important subject, which is what the it's going on with Librela injection. This channel is all about pets, so don't forget to subscribe if you don't want to miss any of my videos, and let's get into it. In May of this year, 2025, a group called Frontiers, which is a science research group, published an article talking about the side effects of Librela injection in dogs and cats. This article created a lot of discussion among veterinarians and pet owners. So today we're going to talk about that, and we're going to discuss kind of like where we're at right now. I'm gonna mention some of the highlights from this article, and then we'll discuss some of the cases that the article published as well. Highlight number one is that the adverse effects of Librela injection were luxation, rapid degeneration of the joints, more conditions like tendon injury or ligament injury, which will lead to luxation of the joint, polyarthritis, fractures, and a lot more cases of neoplasias, aka cancer, of the muscles and bones. Second highlight is that these cases were reported 9 times more often in dogs treated with Librela injection than dogs that actually got another treatment and another medication. And the third highlight is that this study by Frontiers actually supports a recent study from the FDA, which is the U.S. Food and Drug Administration. They also did a study in this matter, and it actually supports the results that the FDA got. So a little bit of background here. In 2024, December of 2024, the FDA issued a letter to all veterinarians warning them about the side effects of the Librela injection, mentioning both neurological and musculoskeletal both neurological and musculoskeletal side effects. In this research, they also saw that dogs treated with Librela would have more side effects than dogs treated with other medications. And they also reported a higher rate of lameness cases, which we all know lameness can be a sign of luxation, fracture, arthritis, etc. So before we answer the big question, I want to show you the cases that Frontiers showed and some of the results they had. First, we have a dog, a lab, and this dog did not have previous trauma, and he presented for a radiograph before any Librela was given. He was 8 years and a half, and as you can see in these x-rays, he had some mild age changes in his joints, but nothing very terrible. Then after 4 Librela injections in exactly 7 months, the x-rays were taken again, and they showed severe changes like we can see over here. In the top, we have the left hind leg, and we can see in this joint humeral condylar fractures with some reaction of the bone as well. And in the top images, you can see the right hind. In this one, we can see humeral intracondylar fissures or tiny fractures. The second case I'm going to show you, it's a 7 years and a half dog, another lab, and they did a CT scan pre and post Librela injection, and they found a very shocking and fulminant change. As you can see in the images, the ones on the left are before, the ones on the right are after the treatment, and you can see a lot of bone reaction, which in medical term would be osteophytosis. So this is a very aggressive joint damage, and the development of this joint damage was very, very fast. And just like those two cases, they have a lot more than you can see if you look up the article online, which I'm gonna leave a link down below so you can find that article and the FDA study as well. And well, here we have another case of a bull terrier with worsening results, and you can see this patient, it's another lab with elbow dysplasia and some swelling of the ankle, and he presented with some lameness as well. In this last case, it's an 8-year-old English bull terrier, and you can see the swelling in the last picture. That's the ankle area. The most important question is, should we stop giving Librela or not? not. Now it's a little bit more difficult to answer this question because there are multiple factors to consider now, like the age of a patient, the severity of the pain and arthritis, and also previous conditions. And just like the FDA and Frontiers concluded, I would say that more studies are needed to have a conclusion of this matter. Because let's say we have a very old patient and let's say he's 12 years old with severe arthritis and he has chronic conditions that doesn't allow him to get a treatment with other medications. Librela will still be a good option because we've seen really positive results with Librela. However, now we have to keep in mind these non-positive results and side effects that the treatment is causing. So I still think that it's too soon to answer this question now, but I would definitely be more cautious when considering giving your dog or your patient Librela injection. We always have to evaluate the pros and cons, and if we're causing more harm than good to our patient, then it's definitely not a good option. I'll make another video talking about the different options that we have to treat arthritis in dogs and cats. So don't forget to subscribe to my channel or keep an eye on YouTube so you can see my weekly videos. Thank you so much for watching this video, and I hope I see you soon in my next one.